Welcome everyone to May's Fourth Thursday's Lunch and Learn. Remember to save your questions for the end of the presentation. We will take questions by phone as well as by chat. Also, if everyone could be cognizant of the sounds at their locations, we're going to keep the phone unmuted for a moment to have a brief discussion before we start. And so now I'd like to introduce Katy Butterwick. She is the Senior Program Associate with the St. Luke's Episcopal Health Charities. We were going to have Celine Meyer, who is the Director of the Center for Collaborative Leadership, but unfortunately she could not make it. And Katy will be presenting the need for collaborative leadership and the development of the Charities Center for Collaborative Leadership program.
Yay! Thank you very much, Ashley. I asked Ashley, one of the things that we've been doing in our program is we always religiously check in and check out, which is something that you guys may do in your meetings as well. And so we figured we might as well try to model that. But when I told her we wanted to do it and see who was in the room, the virtual room, so to speak, she said, that may get a little chaotic and nobody will be muted. And I said, that's all right, that's collaboration. So we are looking forward to kind of hearing. So I wanted to lead off just by telling you that I'm excited to be here. This is really one of the first times that we've been able to give at least some preliminary results from our pilot cohort of the Collaborative Leadership Academy. And I'm also really happy because today I have hair for radio. So I'm glad that this is a webinar and not anything videotaped. Anyone else want to just kind of chime in, maybe share some of the expectations you have for today's session, or just any other thing? I'd love to know kind of who we've got in the room. So, hello. Very quiet. I heard something.
Sorry.
Speak up.
This is Sandy. Can you hear me?
Yes.
Okay. Thank you so much for speaking on this topic. I am thrilled to be here from the breast cancer, arena, talking about collaborative leadership. This is something that I feel that we don't do enough. We're all such strong women, and we all believe in our women's health. And I feel that breast cancer can be just breast cancer, and we should all be working together. And so I'm thrilled that you're here. And then also because, just to let everybody know, there is a Leadership Institute for Nonprofit Executives at Rice. And I joined that program last year because I was looking for leadership. And so I'm thrilled to say that I graduate in a week. And so whatever we can do to share this information with the Breast Health Collaborative and everybody is just, I think it's going to make us so much stronger in the end.
That's great, Sandy. Thank you so much. And I think you may know my friend Julie Falcon, who was in the line program last year too. Are y'all classmates?
Julie, is it Falco?
Falcon, yeah. Falcon. She works at Houston Community College Foundation. Yeah.
So cute. Absolutely, yes.
Congratulations on that. That's a big accomplishment.
Oh, thank you. Thank you.
All right. Who else is going to be brave and chime in?
Hi.
Hi.
So this is Melanie Barr Fitzpatrick giving a call from University of Houston.
Hi, Melanie.
Hi, Katy. Thank you for sharing this with us today. It was very exciting to hear about you ladies conceiving this project originally, so I'm so excited to hear a report on it afterwards. I want to sort of follow up on Sandy's piece in that building collaboration and leadership is something that we all hope we can get more of, especially with the leadership in the breast health community. And from my stance, I'm excited to be a partner with the program at Rice University, while the LINE program that she described, Leadership Institute for Nonprofit Executives, helps folks who are in the field and are professionals already build their skills. Our program at University of Houston is helping the next generation of undergrads and folks who finished their bachelor's recently to get trained to be nonprofit managers. So we love having all those opportunities for professional development, as well as what the Charities offers as that foundation to help us all build ourselves professionally in the sector. So thank you, Katy, for being another one of these partners in a project to help build strength in our community of nonprofit leaders.
Well, you're welcome. We'll see if you still thank me after this webinar, but yes.
Oh, yeah.
Thanks, Melanie. Anyone else?
We have someone typing.
Oh, we've got a message coming in.
Melanie, while you're still on the line, you know of other programs such as this across the state too that are similar to U of H's program?
I do. Thank you for that, Lynn. The University of Houston chapter has been around 20 years, but there are also 2 other chapters in the state of Texas of the Nonprofit Leadership Alliance. And some of those actually may have graduate programs for graduate students as well as undergrad students. Our fellow chapters in the state are at University of North Texas, and again, it's called Nonprofit Leadership Alliance there. And we also have a chapter at UT San Antonio campus. So those are 2 other sets of resources for folks that are around the state of Texas. I also know that at University of Texas in Austin, they have their own sort of version of nonprofit development. I know they have a conference happening in, a nonprofit leadership conference happening in September as well. And then I guess for our folks that might be in far northeast Texas, there's also a chapter at Shreveport. It's Shreveport University. I think I'm getting the wrong name of the university. I don't know if it's a University of Louisiana Shreveport, but I know there's a chapter up there, and I can confirm that if anybody from that sort of Tyler and north east area wanted to know a little more about that.
And I also want to just interject and say too, in addition to that, the line program at Rice, this is the 5th year that they've had the program, and it was brought here by, and I'm escaping her name, she's amazing, she just won a philanthropy award, but she brought it down from the Indianapolis University, where they have undergraduate and graduate degrees. And just a little inside note, Rice is looking to have a master's program in philanthropy by probably next fall. So there's definitely more to come, because this program has been so popular.
That's great, guys. Thank
And
you.
we've even,
Hey guys, I'm gonna go ahead and let's get going. We've only got 45 minutes, and I do want to have time for Q&A at the end. And I want to thank Latina too for chiming in with some thoughts on why she's part of this today. So I look forward to hearing from you. We're going to mute everyone now, and we will take questions at the end. Thanks so much.
All callers are muted and they can unmute themselves.
All right, everyone. So good morning, afternoon. I wanted to come out with a complete, in the interest of full disclosure, we are very much at the Charities in the sponge stage of all of this. We're soaking up as much knowledge as we can from people who are practicing collaboration in the field, from those that are studying it theoretically, and we are looking in our role in particular to be more effective at what we do and what role we can play as a funder in supporting collaboration as a vehicle for deep systems change. So that's really our ultimate goal in all of this, is to really be an effective and supportive partner. But in order to do that, we felt that we really needed to kind of step out into the unknown a little bit. And we've been fortunate to be able to do that with some really great folks. So we're going to do it. Celine, again, offers her sincere apology. She had an unexpected bout of illness this morning. And so I'll be thinking about her and missing her, me in particular, since she was going to do the first part of this. So bear with me. But it's my pleasure to tell you just a little bit more about the charities. So for those of you that don't know, the St. Luke's Episcopal Health Charities, our mission is to increase opportunities for health enhancement and disease prevention, especially among the underserved, and to make possible measurable improvement in community health status and individual well-being. We were founded in 1997. We serve the 57 counties of the Episcopal Diocese of Texas. So that stretches all the way up into East Texas and Tenaha and those towns up in there, back all the way to Austin on the west and along the Gulf Coast to the south. So it's a huge area, about equivalent to the size of Louisiana, that the Charities is tasked with with supporting with our grant making. We just celebrated 15, we're in our 16th year, so in that time we've given about $89 million to 382 organizations through almost 2,000 grants. And these have covered a broad variety of efforts. We focus our effort on, based on the World Health Organization's definition of health, which if anyone is familiar with that, you will know that it's pretty all-encompassing. So we fund everything from preschool to elder care and FQHCs, federally qualified healthcare centers. And we've been really excited to have been part of the Breast Health Collaborative of Texas since the very beginning. And that's been a real joy. So the collaboration at the charities. So this is the story that Celine tells so well, and she has, I think, been instrumental in it to such a great extent. But we like to hope that here at the charities we have a very organic and open relationship with our grantees. We like to try to keep them in the fold as much as we can, and we try to be consistent with our funding year to year. We are only able to make one-year grants at this point, but there's some things in the works that may be changing in the future. So just to kind of tell you a little bit about how we got interested in collaboration, about, I would say, probably 7 or 8 years ago, the charity started convening conferences out at Camp Allen for our grantees. And we would put people around the table from totally different organizations and get them talking about things. And it's, this as well as I do, I'm preaching to the choir, but when you get that conversation going, it's just so inspiring to see the beginnings of addressing issues from a systemic change. We all have so much in common in terms of our mission and values, even though our focus may be very different, that you start to see some real depth of connection and real potential to just come together and make some real impact on the issues that we all care about. And so it was kind of the inspiration, that diversity of opinion around the table and experience that sort of began to kind of whet our appetite for this. And out of that group came something that a few of you may have heard of, I don't know, but the Episcopal Homeless Initiative, which was actually composed of 3 homeless service agencies up and down the Main Street corridor here in Houston: the Beacon at Palmer Episcopal Church, Lord of the Streets, and in Midtown, and then, I'm sorry, the Beacon is in Christ Church Cathedral, I apologize, and then the Way Station at Palmer Episcopal, and then there in the middle, in the Midtown area, is Lord of the Streets. And so all of them were doing service to the homeless, but they had ideas about how to expand their case management. They had an opportunity for some federal dollars through the city. They applied for that as a collaboration. It was the first such application they'd ever received at the city. And their outcomes were just off the charts. As a result, 2 of those organizations still continue to collaborate and offer case management, which is just another term for navigation, which you know well in the breast health community. And as a result, we're able to stabilize lives for homeless people in just amazing ways. And so that, again, was something that the charities saw a role in convening and being able to kind of encourage and pull those people together. So that was a real success for us. But as I mentioned earlier, our recent intention is to really move into this area of high impact grant making. And it's a buzz phrase, there's no doubt about it. But what it means is that we really want to be leveraging our dollars for greatest impact. And that means collaborating not only with our other funders, but also doing what we can to support collaboration among our grantees. So I was brought on specifically to kind of work out this Collaborative Leadership Academy. And I have to thank the charities for taking a total flyer on me. And I've had such a good time doing it. It's been just a real joy and a great walk. So far, I started about 1.5 years ago. And I came from a background in development, so I'd been doing fundraising for about 10 years. So to sit on the other side of the fence gives me a unique perspective from both worlds. So that's, I think, been helpful and really educational for me. So we launched our Collaborative Leadership Academy in January with our first cohort. And of course, as with any program, you want to start, I pushed the wrong one, sorry y'all. You start with definitions. So we kind of like this definition of collaboration, but it's the experience of being in relationship in the context of shared creation. And then the question, what does it take to really become collaborative? And there's several things here, but I think the thing that becomes really obvious to us is that, again, it's just that relationship is so key. I think we think about collaboration in terms of MOUs and all of those structural guidelines that are so essential and very, very integral to keeping integrity in a group. But when it really comes down to it, it's about shared passion for change, and it's about how to really be in relationship actively with one another. And I'm going to just point out here that the folks that came up with this good language are the two that have been facilitating our course for us, Kathy Carlson and Jerry Wells. They're local consultants here in Houston, who we were really blessed to find through strange pathways, some of which had to do with my husband, random, and the environmental world. But they got this. They brought such great skill to the table, and we've been really, really privileged to work with them. And then I'll go to another source if you've done any digging around in collaboration. Michael Weiner and Karen Louise Gray have co-authored some really good collaborative handbooks that get much more into the nuts and bolts of how to actually run a collaboration, how to take the temperature. And these are some of the reasons that they give for collaborating, that it really does change the way that organizations work together. And that's what we're looking to try to facilitate and to support as much as we can, because we really do want to move from this concept of competition that's so inherent in the nonprofit sector, as much as we like to talk about otherwise. It really, the way that we're structured and the way that we run so often is really contrary to true collaboration. And it's through really no fault of any one person. There's a lot of heart for it, but it's just the structures can be a little bit challenging, I understand. So, all right. So just to walk you through a little bit of how we started thinking about this. We needed some guiding principles. We needed a plan for evaluation. This will be music to some of your ears and not to others. And we lived and breathed a logic model for quite some time. Jenny, I know you're on the call, and I have to say with Komen, I recalled some of my experience in the trainings that y'all run for your logic model. And I was very grateful for that. But we needed to know what success looked like for us. And we also took us through the process of the IRB. So if you're not familiar with that, but it's a very formalized process used in research that involves any human subjects. So we actually had approval from the St. Luke's System IRB. So all of our subjects were very well protected. Lynn, do you feel protected?
I do.
Okay, good. So we needed a structure, and we needed to know what we were going to do with this program, and of course we needed participants. So more than anything, we needed help. And so we started looking to other people that we could talk to. And I put a quote there up at the top that came from one of our cohort members. Of course, these are all anonymous, but it says, you know, I have the expectation of high quality from the charities. I am looking for hope to hang on to. Wow. I mean, that's a really big call to action, and a really big, responsibility that we felt that we had, based on just a participant's expectation for the program. I mean, if you're looking for hope, boy, we want to do everything we can to give that to you. So we had a lot of guides. I'm going to fly through these pretty quickly. We polled our potential participants. We had a really good response rate on that. We talked to our advisory council, which is a 15-member group. Some are funders, some are leaders in the community. It was crazy to hear from them. They talked a lot, had such an energy around collaboration, although I don't know that any of them really know what it is any more than we did at that point. But we had some really great conversations with them. The charities team, some of you may know, we have kind of a dual personality at the charities. We have both our grant-making arm and our research team that specializes in community-based research. So we brought them on board and engaged them. Of course, I've mentioned our facilitators, who were just instrumental in design. And then, of course, our evaluator, Dr. Kay Bartholomew, who works at the UT School of Public Health. And she has been a real pleasure to work with as well. So it goes on. We started looking locally, nationally, regionally at things that are not on here, or local AFP chapter. We've heard about the Lion program at U of H. I remember having a great conversation with Melanie about her work and what she's doing in the undergraduate space. And then we came up with these guiding principles, things that we thought were really important. We wanted everything, probably more than anything else, to be experiential. We really bought into this concept of it being a lived experience, that instead of actually doing work that was so traditionally kind of didactic, you really wanted people to go through the opportunity to work a problem or a project development together as a collaboration. And we found, at least in our initial findings, that that's really worked, that it has been essential to the progress to date in the project. So that was probably the one piece of this that I would really call out. So we had 13 members in our pilot cohort. Woohoo! Lucky 13. I know someone in the beginning, I think maybe Sandy, it was you, talked about women and how, and particularly in the breast health field, there's so many strong women in the room. And Lynn, you may talk to this, but we had 13 strong women in our cohort. Those were the folks that were selected to participate. They're all decision makers within grantee organizations. We decided for at least this first cohort to limit to building capacity within our grantee organization. And so that's kind of how we launched this. So they have been very generous with us. They have given of their time ad nauseum. We're now approaching our sort of final presentation to the advisory council on May 31st. And in the meantime, they've given all this time. We've spent, probably, 8 to 10 days, full days out at Camp Allen in Navasota. They've contended with outdoor activity. Anyway, it's been great. So we did adopt a retreat format where we did take them out for these 4 gatherings throughout the spring, and really got them in the room together and just really didn't let them out. And we've got a lot of good feedback about how important it was to keep them there and ply them with wine. Not that I endorse drinking to excess, but it has been, I think, helpful in some aspects. This is really intense work, so that's just a little more about all that. So what are we doing differently? I referred to this earlier, and I mean, it's not groundbreaking necessarily, but I think for what we were seeing nationwide, we really did, again, want to do this integration model. So we chose to give them the charge to kind of focus on the area of homelessness here in Houston and Harris County, and to come up with a project in that area and with that subject that they thought would be something that they could really be a leadership body around. And so that is how we chose to focus their work. And there was a lot of debate about that. You know, we thought, well, we would just put 13 people in a room and just let them organically come up with a project. You should know we had all of 4 of those 13 from organizations that actually do homeless service. For the most part, folks are not coming to it from an aspect of homelessness. So it was kind of risky, I think, to go this route, but in the end, we felt like with the timeline as it was, we needed to give them some focus so they could really just kind of get their teeth sunk into something early. So the other thing that I think is really important to us is that we build capacity for individual as well as group leadership. And when you talk about group leadership, that's something that I have now seen lived, and it is amazing. It's messy, it takes a lot of time, but it can be done. And it really, if you learn those tools of dialogue and respect, it can work. I've seen it work. So these are just a few of our early outcomes from the program. I thought that might be interesting to some of you, and then I'm going to let you hear firsthand from Lynn, who's actually one of our cohort members. We're so fortunate to have her with us here today. What's different now? The CLA participants, after all this time together and learning a lot of different tools, they really are sharing personal impact a lot better than they used to, and this is something that is interesting. As workers in this field, we tend to go towards solution. We don't want to spend a lot of time in how something makes us feel or what impact it has on us. So one of the first things that we did is we put them in fish bowls, and we asked them just to talk about why homelessness was important to them. Why was that an important issue? And the responses that we got were just startling. To a person in that group, they could begin to see how homelessness had affected them in very, very personal ways. And I think it had a lot to do with just sort of defining it collectively in ways they hadn't thought about. So that was really, really intense. And that was the very first thing we did. And so rather than starting with data or starting with the map of the system, we actually started with this place of personal passion and commitment and experience. So I think that really was key, is learning how to just stay in the emotion a little bit.
And can I interject?
Yeah,
there
absolutely,
too,
Lynn.
that it was one of those experiences that, we all started off crying, because we were all sharing some, and I, not being in the homeless community, I mean, I didn't realize really homelessness and that could be. I mean, after hearing all these stories, and then really kind of reflecting on, some of my personal experiences, I had really experienced it also, and so, we started off crying, and then we'd be laughing and crying. So it was a very intense. I think that was only 2 days that we.
Yeah, it wasn't much time.
It wasn't much time. So
So
I just wanted to say that while you're
absolutely chime in anytime, Lynn, because that would be fabulous. Please just come on in. So the next thing I think that was kind of a major takeaway was that they realized that you can really make a commitment to a group of people before you even really know what the work is. And I think that was essential as well. And as many of you are in coalitions or forming coalitions, I think you begin to understand this, that it becomes almost a commitment to the body of people, that it has its own kind of personality. And you really can, as an individual, and on behalf of your organization or not, but as an individual, you can really commit to that group, even when you're uncertain about the way forward. And I think that was really kind of transformational thinking too, because we all kind of figured that, I don't know, it blew my mind a little bit that they could get there.
Well, and I want to say, I think when we all got in the room, we felt like we were being fully committed to the charities. You know, I think if we didn't have that initial buy-in from you guys, I don't know if we would have gotten there as fast, but I think we all felt comfortable that, you know, what you guys were doing, were trying to, you know, better the whole system and improve homelessness. So I think we all felt that love, I guess, it's kind of corny, but it was like a nice, healthy, like, oh, you know, we trust you guys, you know, and then we ended up really trusting each other.
Yeah.
So
Yeah.
it was a nice.
I thank you for saying that, Lynn. That's very, that warms my heart. I'm glad. That was definitely our intention. It was to just let the process happen and to not intrude upon it any more than we had to, which wasn't much at all, I hope. So this was another skill I think that came in really handy to learn, and that was this idea of active listening. Again, this isn't a new concept, but in a group in particular, it can become really easy for someone to throw out a question or an idea, and then people start chiming in with responses, and then they go off on their own tangent, and no one actually comes back to finalize what was initially said. And I think the facilitators were really good about bringing us back to that core skill, which is don't let an idea just dissipate. Let's actually bring it to some sort of conclusion, even if it's just that, well, we don't know an answer now, but thank you for raising it, so that that person feels heard, but that also you actually gather some real data in the process. So I don't know.
And as having, like, literally myself and 12 other very strong women in the group, you know, I think that's where sometimes we get so caught up in, you know, cranking out the products so fast that we stop and we don't listen very well. And I know I've taken that, and I'm looking at my staff right now. I'm working on that. I mean, I can tend to be focused on something else, and I'm trying to stop and listen. So I think it's one of those tools that helped me hopefully be a better, you know, boss.
Yeah.
And then also in some of our projects that we're doing now, I'm really stepping back and taking that time, which collaboration takes a lot of time if you're doing it right. I mean, if you're really trying to engage people to commit to a project, it is truly listening actively to what they want also, and making sure that they have that buy-in.
It takes a lot of time.
It takes a lot.
And you referred to something there that I think was great. It was an intention of ours. We hoped that there would be impact on the organizations that these folks work at. I mean, our hope was that you'd be able to take some of this skill back into your organization and to really apply it, and that it would strengthen the concept of collaboration throughout organizations at all levels. And so that's really exciting to hear too. And you're not the only one that shared that. You know, folks have really used some of this in their own management and found it really, really powerful and effective. So.
Well, and I think I want to add too is when you are working on projects, and we were working on a project with a community health center, a local community one, and we really kind of had to step back when we wanted them to be engaged in it, and so we really had to listen to what they wanted, you know, and I think that's, in order to get their commitment, we really had to say, well, what can we do for you, you know, and listen to that, and sometimes it may not be what we wanted to hear, but again, it kind of evolved, and it worked out okay, even though it wasn't the direction that we wanted to go in. It was another direction.
It was the direction you could go in with that partner at that time, you know, so that's a wise thing to realize. So this is about remaining in dialogue. This is a tool that we use that they introduced to us, and it really does work in terms of, so often, again, like I've been in nonprofits my whole career, you get stuck, like you can't get past an issue, you can't sort of understand how to move conversation forward. You keep having the same dialogue again and again. And so there's this skill called moving, following, opposing, and bystanding, and it's basically referring, and I can talk to you more in detail about it offline, I'd be happy to, but it refers to just roles that you can take in conversation. And so we began to, in a sort of democratic way, like people would have proposals on the floor, and we didn't leave that proposal until it had been adopted or counterproposed or tabled. I mean, it goes back a little bit to Robert's Rules of Order in a much more touchy-feely way, but it really did shake some things loose. I think that ability to sort of neutrally make a proposal, say, I follow that, I'll stick with you, or even to say, I don't support it, but I'll support. I mean, I don't like it, but I'll support it. It's like maybe it's not my favorite proposal, but I'll support it. It gives you freedom. Anyway, I can, like I said,
Well,
I
and,
can go
and
into that all.
I'd like to interject, since you're talking about that, one of our, we did like a 3-day session up at Camp Allen, and one of the days we came out with this great proposal, everybody always like, okay, we stand by it, we really are, support that. And the next morning, one of the women came in and she goes, well, I'd like to make a proposal, and she just totally like,
She flipped it on its end.
flipped it,
Yeah.
but it was interesting. She was able to flip it, and we all got on board with it.
Yeah.
So, I mean, even though it was a totally different direction from the day before, it moved us forward and gave us a different perspective on it. And it was very exciting. We all were like, why did you bring this up now? But it was really to the betterment of the
Right.
whole process.
Right.
So,
Moving on forward to the happy hour. Yeah, exactly.
Yeah.
So this was another important skill that we focused a lot on, and that was once you have a project and you have a vision for what you want to accomplish, how do you really enroll the people that need to be your stakeholders? And those are folks that can be all the way from the clients, from the actual homeless people that are impacted by policy, to the decision makers and those that have different levels of investment in the issue. Perhaps they're very powerful, but they're not necessarily interested, right? So you have to kind of categorize those folks. We learned some tools around that, how to really sort of map out what your strategy should be so that you can really focus on those people that have the highest level of influence and the highest level of interest and kind of low-hanging fruit, if you will. So sort of start from that point.
We even did like role playing on how you would approach the stakeholders on, building your case and getting them engaged in the process, which is just fun.
So this was one that we kind of brought home at the end, but I think everyone knows is so essential, and that is this concept of integrity, basically doing what you say you're going to do. And one of the things that our facilitators brought home was that tolerating a lack of integrity is in itself a lack of integrity. And that in a group, that's sometimes the hardest thing for us to identify and to do. It's hard for me in particular. I don't do conflict, quote unquote, very well. And so, the idea that if someone isn't fulfilling their commitment, it's not about shaming them, and it doesn't have to be done in a public format, and it can be done one-on-one, but you do need to at least bring attention to the fact that something hasn't been done that was promised. And how can you support its happening? I mean, that needs to be the question. Another metaphor that came out of this a lot was that a group is like a flock of geese. And if you know anything about flocks of geese, the one at the very point is breaking all the air out of the way and working really, really hard to get them where they're going because they fly in that V formation, right? But they alternate, and the one that's in the lead and spending all the energy goes to the back, and then a new one comes into the front. And so the idea was that there's no need to feel shame or guilt if you're in a group if you can't fulfill an obligation. That's just an invitation for you to call on the group for help. That you all have your turn in the front, really putting out a lot of energy and working hard. That there always is others to come and step up and get you. And I mean, that's essential, I think, to being able to make progress in the group. So that integrity piece is huge. So then just to the very kind of basics, I think the networks that have been formed, even among those 13, are just so powerful. You know this. You're going to meet people, and once you get into that mode of sharing, all of a sudden this little spoke of one person that maybe interacted sometimes with someone else is now just this amazing web of connection. And it's been one of our challenges to try to capture that. We'd like to illustrate it, and there have been some foundations that have done really good work in this area, just in whole communities, like intentionally networking people together. But I think that's been really exciting. And there have been some tangential collaborations that I've seen start as a result, referrals that have happened, projects that maybe aren't around homelessness, but their organizations are well positioned to do that project together, and they're starting to have these conversations. I mean, that's huge. For us, our intention with this, as much as anything, was to build that collaborative leadership capacity. And we'd love to make progress in homelessness. We don't look to this group to solve it. That's not the issue. But what we wanted to do was really build that capacity. Okay, so building a learning community and an environment of support for change, that's been huge too. And there's a lot of things that play into that. Some of them are just really hard to define. But I think, again, just that commitment of time, that commitment to the process, to the difficulty, to the murkiness of it at times, that's been really huge. And this struggling piece, oh boy, there's been a lot of struggle. I mean, I would say for every moment of revelation and cohesion, there have been hours of really just, I don't understand, and I'm confused, and I don't know where we are, and I'm here in the room, and I trust you guys, but I'm miserable, you know? And I mean, that's part of it too. It's just, it is that. It is messy. It is really messy. So they've struggled with the time commitment. They've struggled with, you know, not being able to be as fully engaged as they wanted to at times, you know, those kind of things too. So, and this is a little bit more. So they're building all these capacities. I really have seen this. I mean, it's amazing that it comes together. And I think maybe the one that is most important in the nonprofit world is that last one, self-care. And that is that we so often don't think about caring for ourselves. And I think there's something to be said about the whole process of learning how to really say how something impacts you, to like go into that emotional space that helps you to care for yourself, to be a little bit more aware of how things are really impacting you and what you need to be supported and comfortable. So this is another thing. I mean, they have an opportunity to really engage and have engaged already public and private funders, and also partners in support of different projects and recommendations, particularly this one that they're engaging around homelessness. And so one of the stages in stakeholder enrollment is to actually go out and see what they think about it, you know, just really get into the place that they are and understand where that stakeholder is coming from and have that conversation. And I think Lynn, you pointed out very well in the class that, you know, it's probably been a while since these people were just asked what they thought. You know, I mean, we always kind of go in with an ask. We go in with a request. Like, this is what we want to do, you know, and we want this from you, you know, as opposed to kind of reversing it and saying, this is what we think this is the opportunity we see for your engagement, and this is how we think that it can benefit you. So, yeah, so this is their project mission. This is a draft. I mean, don't publish it, please. Thank you. But they got really energized around this idea of creating a grassroots advocacy campaign that would really build community will toward a response to homelessness. And this goes a lot toward NIMBY, that not in my backyard mentality, like trying to just address some of that. I think this is an outgrowth of the experience they had, which began that first day when they began to realize that this is really about personal connection. And now what they're trying to do is take that personal passion and commitment and really make it available to other people, to kind of make that process in some way a little bit available to a broader community. That's a challenge. I want to get to what Lynn wants to share, and I know we're, goodness, almost out of time. But, you know, our evaluation is underway, and have we seen mind shifts? Absolutely. We've seen a ton of them. I think, you know, people have really valued the time they spent, at least that's what they're telling us. I think that one of the most fundamental, and this is one thing I would just say, and that is this idea that social change comes with passion and commitment, not with data. Now, you have to know your audience. There are people who will really respond to data. Like, that's the way you get their attention. But when we would do these role plays and we would have these conversations, and people embodied these stakeholders, the resistant ones, really, really well. But when we had these conversations, you could feel the energy shift when it got to a place of emotion, to personal experience, to passion. That's, we all know, that that's the sweet spot. That's where you need to get in order to really enroll a stakeholder in your work. So, like I said, Lynn is one of our fabulous first 13. Yay, you survived! So, I know, right?
I want to just say a couple of things really fast, because I know you guys want to probably ask Katie some questions, and we're down to 4 minutes, so I'm going to make it really fast. I know, you know, this experience has been really an eye-opener for me. You know, being in a room with these other executive directors, primarily executive directors, who probably had over 200 years, I think, we compiled of years of experience, you know, and I had my lonely, you know, 2.5 years of experience as an ED for the Breast Health Collaborative. So to hear their making this commitment was a lot because they had like huge organizations. But they really benefited from it. I benefited tremendously, but they even benefited. They learned new techniques that they didn't know about. They're already implementing some of like the fishbowl approach on, bringing a group together to kind of, share their experiences, and then the outside group kind of listening into what this group is talking about, and we can talk more in detail about it. But it's a really great way to bring on dialogue in a very safe, secure, nobody's criticizing kind of a manner. So, for me, it was great to see all these experiences and really to see the heart of and the soul and the passion of some of these women who have been working in the community, trying to end homelessness for many, many years. So I'm making the ask that I hope that, I know like Fort Worth, we've got some people from Fort Worth that are listening on today, and I know their goal is to do more collaborative initiatives, but if maybe they could reach out to a funder such as the Charities and see if they might be able to do maybe a short training like this. But the thing that made this so successful was that we had to actually work on a project, a live experience. I mean, it wasn't just this fictitious, you're learning this information, you're going to learn it, you're going to go try to apply it. I mean, we really actually lived the whole experience, and I think that's what made it so much more successful. And also, we knew that the Charities was going to give us some funding to kind of help implement this project. So that in itself kind of broke down the barriers. We all had that we trusted each other, and we all, wanted to make a difference. So I'm encouraging that if we do have any funders on the line to maybe, get together with Katy, kind of on how they set it up, because I think, even from the executive directors, we had a couple of people that were in non-executive director levels, but they learned so much about it. In fact, one was Lone Star, who was up in Montgomery County, and I mean, she did interfaith ministries, and she just like really studied hard, and now she's doing some of the techniques that we learned within their system. And so, I mean, I think it's not only just on collaborative, but it's on your staff building and really just bringing that whole sense of teamwork and, trying to get to the end results to make things better. But I just really want to encourage that. So,
yeah, I'd be happy to talk to anybody on any level about this. I mean, I can, this has been a very high level overview. We could spend an entire 45 minutes on any one of these topics, but I do want to hear from you, but I also want to just put my contact info up there. So feel free to reach out to either me or Celine.
okay.
All callers are muted.
Oops.
All callers are unmuted.
Yay, you're unmuted. Okay, so it's on, y'all. I mean,
Melanie looks like she's clapping.
yay, Melanie, thank you.
Any questions?
I know Jody Hopkins is on the phone from Lone Star Charity. I know it's a long one. Charitable Communication Association, right, Jody?
Lone Star Association of
she's
Charitable
typing
Clinics.
now.
Yes, thank you. Highland. But yeah, I mean, it would be great for maybe if she could possibly get some funding and organize a group of some of the charitable organizations to work on some issues that y'all have. I mean, it's a really neat approach to collaborative thinking. Let's see, we've got a couple questions. Evelyn, thank you so
Thank
much.
you, Evelyn. She just said thanks for the information. I'm afraid it was all information, no conversation. I apologize for that. Thanks, Jody.
With our statewide future would be a great project.
Any other questions? Anyone on the phone?
Or comments? I mean, we'd love to hear from you too, just on what you're experiencing, something you're facing that's a challenge. I mean, any of that.
I guess you covered it all.
No, it's not. It's never a good time when you don't have questions. Well, thank you so much. Again, I encourage you, please do contact us offline. I mean, whatever role you might be looking to play in this.
Is there?
Oh, will there be a second cohort?
Oh, I think we have some questions.
Yes, there will be a second cohort.
Yeah,
And
Great.
probably a third and a fourth is our intention. You know, the Charities is kind of undergoing some change. The system that established us, the health system, has sold to Catholic Health Initiatives here locally. And so as terms of that sale, our understanding is that there will be $1 billion influx into a new entity called the Episcopal Health Foundation. And our understanding now is that the Charities work would just kind of pick up and drop in there with a little bit more capacity for grant making, but also hopefully for doing this collaborative support work. So again, I mean, we're just trying to figure out how to occupy a space as a grantor that's productive and supportive of this work. So yes, our intention is to keep cohorts coming. I'm not sure yet when. I think we may target next fall, just because we have a transition ahead of us to bring the next cohort through. But thanks for that question, Jody.
Okay, so if there are no more questions, thank you so much, Katie. That was a great presentation. We'd also like to thank this year's program committee for organizing our webinars. The committee is chaired by Laura Pena of Harris Health Systems, and the members are Lizette Martinez and Yesenia Moore of Harris Health and Gina Lawson with ECCS. Our next webinar will be June 27th on translating evidence into practice with evidence-based program information, presented by Jenny Thompson-Kirkland from the Houston affiliate of Susan G. Komen for the Cure. The registration is available on our website at bhctexas.org. And we thank everyone so much for your attendance.
Have a great day.